Let me ask you something, and don't answer it quickly. Right now, do you know exactly who has access to your patient data? Not in theory, not generally, but right now. Because most organizations think they are compliant until they ask to explain that. HIPAA is one of those terms everyone recognizes. It sounds familiar, it feels handled, but here's the real challenge. HIPAA doesn't fail loudly, it fails quietly. Not through dramatic cyber attacks, but through comfort. Shared login because it's easy. Access given once and never revised. Reports downloaded just for now and forgotten in the personal inbox. Former team member who has moved out, but you don't close the access. Nothing feels wrong in this movement until months later when question starts coming. Here's what you have seen again and again. HIPAA isn't just about protection, it's about moment. Who touched the data, when they touched it, why they were being allowed to do that. When these questions aren't clear, ownership fades. When ownership fades, mistake multiplies. And those mistakes don't show up immediately. They show up as denials, disputes, audit, and lost trust. From an RCM perspective, this is where the damage quietly begins. HIPAA and revenue aren't separate conversation. Here is the shift, which I would think you should have. Stop treating HIPAA like just a legal checkbox and start treating them like an infrastructural change. Think about a building. You won't give your every employee access to every key, not because you don't trust them, but because structure creates safety. The same applies to data. Not everyone needs access to everything. Some access are essential, some access are unnecessary exposure. And 6 months later, when question comes up, the system should not be able to explain itself. That's when compliance stop feeling heavy and start feeling intentional. At Revesolv, this is how we approach HIPAA. We design workflow that answers before they are being asked. Who needs the access? What information is truly required? What can be restricted without slowing down team's work? When systems are built this way, team work with confidence, provider feel protected, and silent risk don't room to grow. HIPAA done right doesn't create frictions. It removes uncertainty. So here's something to reflect today. If someone reviewed your workflow, not your document policies, but your actual day-to-day operation, could you clearly explain who has access to patient data and why? Because clarity isn't compliance, it's the control. Thank you.
Revesolv. First you, then us.